welcome to the show. Thank you so much for doing this. I really appreciate it. I've been trying to have you on for a while. A lot of stuff has changed in the last couple of years, few months, last day or so. What is your take on this latest story? Now they're saying the avian bird flu. Do you have any opinion on this? They're saying this is going to be 100 times worse than COVID-19.
I think that's an overstatement. There is some periodic kind of fear mongering around the bird flu or avian bird flu. And in Texas, it was mentioned that someone tested positive. They didn't say he was sick, tested positive. So anytime you hear the word tested positive, then, I think you should probably put in quotation, parentheses, not sick. So it's typically a zoonosis that is, birds to farm animals. Rarely it could infect a human. It should be self-limiting and not a problem. So I expect you'll see a die down in bird flu craze here in the next few weeks.
Okay. Yeah. It seems like there's always something. Even after COVID-19, there was the monkeypox thing that was a big craze for a little while, and then that died down. And so, yeah, I'm always trying to pay attention to the news. So you're thinking that's a little bit overhyped.
Yeah, that'll be overhyped. I'll tell you something else hyped is an old disease, and that's measles. So there was a story that Florida Surgeon General Joe Ladapo has said, listen, measles is not a big deal if the parents want to skip vaccines. We haven't had a measles death in the United States in years and years and years. And if there is, it's typically a secondary staphylococcal infection in the lungs, again, which would be appropriately treated with antibiotics. And last night, I was at a big public seminar in Southfield, Michigan, and Dr. David Brownstein, who spoke ahead of me, he showed a clip from the Brady Bunch, where the Brady Bunch all got measles, and they were so happy they'd got a few days off of school, and they're all fine. And just, again, showing in the early 70s, what a mild disease measles was. So once we had modern hygiene and the ability to handle a rare complication, getting measles is not a big deal at all. If we get the natural infection, we have lifelong immunity. If we take the vaccine, we don't have immunity, unfortunately. So most of the outbreaks that occur in people getting measles is those fully vaccinated.
Really?
So I personally was given the measles vaccine, and then later on had titers checked, and they were negligible. I had to get revaccinated when I was entering the medical field. So the measles vaccine doesn't work, and it's, again, the disease has been overhyped. The vaccine is minimally effective.
That's interesting. I haven't gone down that rabbit hole yet. I'll have to look into that one. But so the other thing, the news story that came out, I think this is why I reached out to you again, because the COVID vaccine, they said there was a big article that said there's a slight increase in heart, brain, and blood disorders. Do you feel a little bit vindicated now that some of this stuff that you've been saying for years is finally being revealed?
I wouldn't use the adjective slight. I mean, what we're seeing in terms of cardiovascular, neurologic, thrombotic, and immunologic complications is an avalanche. It's not slight. I mean, there's a massive number of people suffering these events. We now have all-cause mortality rising everywhere in the world among those who took the vaccine. So I wouldn't use the word slight. Yeah, I was right from the very beginning to question the safety of the vaccines. I was the only public figure who published. In August of 2020, I published an op-ed called The Great Gamble of the COVID-19 Vaccine Program. You're talking to him. There wasn't a single chief of medicine, wasn't a single public health official, no media person. No one questioned the vaccines except for me.
Yeah. And now, so that article comes out, and again, they say, I think maybe this is just is this the tip of the iceberg when they say slight? Is it going to be worse as time goes on? Is more going to be revealed and be admitted to?
Right. Slight means tip of the iceberg. They're trying to understate a gigantic problem. When we start to see sporadic safety events, remember, none of these studies have complete reporting. So there are a ton of people suffering that haven't come forward yet to their doctors or to hospitals. And you're right, it's the tip of the iceberg. Again, the four major areas: cardiovascular, neurologic, immunologic, thrombotic, and there's a fifth emerging area of cancer. We're particularly worried about cancer now I testified in the U.S. House of Representatives January 12, 2024. I told the committee, listen, we've got 5 to 15 years of worry now because these are genetic transfer technology platforms. We're talking Pfizer, Moderna, Janssen, and AstraZeneca. These are genetic shots. They last in the body a very long time, maybe forever. So we now have a tremendous, long-standing set of health concerns in those who took the vaccines.
Yeah, and that scares me. And I'm seeing this buzzword, turbo cancers. What is a turbo cancer? Is there any truth to this? Is there any evidence? Is there any statistical significance to the cancer rates for people with COVID vaccine versus unvaccinated? I mean, is there anybody tracking this?
In the United States, the U.S. CDC should immediately merge the vaccine administration data with the cancer registry data, and they refuse to do it. Wikipedia has a entry out there on turbo cancer saying that the vaccines don't cause turbo cancer. Now, why would they say that? Why would they even bother with turbo cancer? Well, it turns out now multiple peer-reviewed manuscripts are describing cancer in people who took the vaccines. There's plausible mechanisms of action on why the vaccines would cause cancer because they are genetic transfer technology platforms, and they're long-lasting. It may be dose-dependent, maybe one shot, not much of a risk, but 3, 4, 5, 6 people in the government narrative would now be on their 9th shot. That's plenty of shots, enough over time to cause cancer because the messenger RNA impairs DNA repair. Pfizer, Moderna have process-related impurities in them, DNA fragments of a cancer-promoting gene called SV40. And then finally, the spike protein that's produced from the vaccine impairs tumor suppressor systems. This is all summarized in a paper by Anguis and Bustos. As we sit here today, the COVID-19 vaccines likely cause cancer, and anybody who's taken a vaccine should be vigilant for the emergence of a malignancy.
Yeah. So what goes on with the COVID vaccine and COVID is they both, it's a spike protein, right? And you're saying that, because I think initially, didn't you say that people couldn't get COVID twice? So if they had symptoms, was that still from the initial time they were infected and it was like re-emerging?
From the start of the pandemic through the beginning of December 2021, by and large, people didn't get COVID twice. But when the virus mutated into the Omicron variant, then people did get it twice, and the vaccinated obviously got it multiple times. So it really had to do with the viral mutation. Now, COVID itself clearly causes long COVID syndrome. It causes blood clots and some of the neurologic problems. COVID itself does not cause serious heart damage or myocarditis. COVID itself does not cause cancer, has not been implicated in cancer. Now, sadly, the vaccines don't work. So most people who took the vaccines got COVID anyway. So now they have both exposures, but it's largely the vaccine that's causing trouble for the vaccinated.
So then what's going on with the long COVID? Because I saw an article too that said long COVID is a myth. It's not real, but I've got all these people in a Facebook group that are suffering, and I mean, they're looking for answers.
You're right. Remember, you asked about, a subtle rise or what have you. Just use your common sense. Are people around you telling you that there's lots of problems? Yes. Long COVID's a real problem. About 50% of hospitalized patients get it. Overall, it's about 15% of the COVID population gets it. A paper by Dexner and colleagues show about 70% of long COVID is driven by taking the vaccines before or after COVID. So the vaccines make long COVID markedly worse. People get headaches, can't taste or smell, numbness, tingling, various forms of tremors, chest pain, effort intolerance, blood pressure going up or down. It's really a miserable syndrome. It's most effectively handled with a new protocol, and we've published and copyrighted this, called McCullough Protocol, base spike protein detoxification.
Yeah, I think that I think I have all the ingredients here that you've talked about. It's the nattokinase. How do you know how to say that? Nattokinase.
Yeah, nattokinase, good.
The bromelain and the turmeric curcumin. It's like a liquid one that liposomal, I think you call it.
Perfect. So there you go. So One can get this combination on Amazon or any online retailer, natural health stores. It's very affordable. We have 2 peer-reviewed publications on this proposal. Nattokinase, at least 2,000 units twice a day. That dose can go up. Bromelain, 500 milligrams a day. Again, that can go up. And then curcumin, 500 milligrams twice a day. But again, don't be afraid to increase doses. We need at least 3 to 12 months of this in order to resolve long COVID syndrome. Many times we add additional drugs or supplements to it, but this is McCullough Protocol based spike protein detoxification. It's the only such protocol that's met peer review, and it is now essentially becoming the worldwide platform. So recall, for the treatment of COVID-19, McCullough Protocol, acute treatment protocol, became the worldwide standard, and now the same is occurring for the vaccine injured and those with long COVID.
Yeah. And how did you come up with that regimen?
My practice partner, myself, Brian Proctor, we tried all different methods in the clinic. Nothing was working, various drugs, until we settled on this combination. We had to have enough patients observed for long enough. Then we started to see them resolve their syndromes, and it became clear. It became abundantly clear. We tried it in family members, and we said, listen, nattokinase and bromelain dissolve the spike protein. The spike protein is in large quantities in the human body after the vaccine, smaller quantities after the infection. We have to help the body get rid of it. That's what they do. Curcumin blocks the inflammation from the spike protein. So they're a perfect combination and trio.
And these are relatively safe over-the-counter supplements.
They're relatively safe. Now, bromelain and nattokinase are forms of mild blood thinners, so we have to watch for any signs of bleeding. If there's a serious soy allergy, trace amounts of soybean oil could trigger an allergy, but again, we can manage that easily. But you're right, people have used these for decades. The Japanese use nattokinase as a cardiovascular or heart supplement for decades. So, even if you didn't have long COVID, people use these supplements for the health benefits.
So these would help both long COVID and people who had vaccine COVID injuries.
That's correct. And the main point here is people need to be patient. It takes a long time. Ringing in the ears is a real common one. That one won't start to change until about month 4 or so. Numbness and tingling, again, probably 6 to 9 months. Heart pounding, palpitations. It just takes a long time. But we start to see a fall off in the antibodies against the spike protein. People get better. And when they finally resolve it, they're so happy because so many people have been miserable now for a couple of years.
Yeah. I mean, I'm just getting all these people ask about this, ask about this. I mean, I've heard everything from like a weakened speaking voice to hurt joints. I mean, some of the things you mentioned, rashes, exercise intolerance. But one thing that I had is that, and this was originally from COVID, was I lost my sense of smell. It came back, but it didn't come back 100%. So with this regimen, you think that would help it bring it back to 100% or closer to?
Right. So I commonly recommend the McCullough Protocol based spike protein detoxification for people whose sense of smell hasn't come back all the way. And then what you want to use is you want to use a xylitol based nasal spray at least twice a day. The one I like the best is called Clear, XLEAR. Use the Clear recovery spray, 2 puffs twice a day, and over the next few weeks or months, it'll come back.
Okay. I'll try that. What is silent hypoxemia? Have you heard of this?
Well, yeah, you may be referring to just, low oxygen levels, hypoxemia.
Hypoxemia,
that can occur due to what's called microaggregation of red blood cells. And that's because the spike protein hooks up red blood cells. They don't exchange oxygen properly in the lungs. And again, that's where the nattokinase and bromelain will play a key role. And it's going to take a while, but patients do improve.
And then somebody had a question about the reactivation of like Epstein-Barr virus and Lyme disease. Is there a connection there?
For sure. It's been well described. Reactivation of Epstein-Barr, of which 90% of us have had that, cytomegalovirus, as well as Lyme disease can reactivate us because COVID's a bad illness. The vaccines are very toxic exposure. So many times we have to additionally treat those reactivation syndromes.
Yeah. And then what about this? I don't even know how I'm going to mispronounce this as well. Polymyalgia rheumatica. Is there a link with that in COVID vaccines? Are you familiar with that?
Polymyalgia rheumatica is, it's a relatively rare internal medicine disorder of severe muscle stiffness and pain. It can be associated with what's called temporal arteritis and monocular blindness. It would not be surprising to me if long COVID and the inflammation can trigger it, but it takes a particular response. It's one of the few syndromes where we need to give very prolonged corticosteroids, like talk about 3 months of prednisone, but it can be resolved.
So some of these issues need more than just your protocol. They may need some drugs,
Right.
some prescription drugs.
Right. So most of the autoimmune syndromes will need additional drugs, for sure. People with blood clots proven by ultrasound or CT need additional blood thinners. People with high blood pressure, heart rate abnormalities will need additional drugs. So they need to see a qualified doctor who's treating long COVID and COVID injury patients, preferably an unvaccinated doctor, so the doctor can be objective about it. Most doctors are taking the vaccines. They just can't think straight about this problem because they're terrified themselves of what's in their body.
Right. There's like you said in your book, I think you talked about this. So they're kind of like test subjects themselves, so they can't be impartial.
Right. You can imagine what if you had a doctor with a brain cancer? Well, he's not going to be objective about the next patient with brain cancer. They just can't. So you really want to ask the doctor if they're unvaccinated or not, and can they give an unbiased assessment?
Yeah. Now you talk about the blood clots. Can you explain this to me? Because I just don't understand this. I'm seeing all these videos of embalmers and they're pulling out these long white strands. I mean, it looks like something from the movie Alien or something. And some people are saying, oh no, that's a conspiracy. That's totally normal. But the embalmers are saying, we've never seen this before until COVID or COVID vaccines hit. So what is a doctor? Is that something that's normal to have these long white strands being pulled out of people?
Well, there has been a survey of embalmers done by Thomas Haviland, and he's clearly shown that this is a secular change. Now, what has not been done is to stratify patients, the deceased, by whether or not they took the vaccine. And so we simply don't know. We just know that people are more prone to blood clotting now after they die. Normally the blood liquefies, it drains out of the body normally. I think it's probably diffuse spike protein exposure, but until we see better data on stratifying according to vaccinated versus not, it's hard to draw conclusions.
Can you test for the spike protein? Is there a blood test for that to see if it's in your body or if you still have it?
We test indirectly with what's called the extended range antibody test right now. The one we use in our offices by LabCorp. Soon we'll have the direct spike protein measurement. Several companies have it now. But yeah, everybody should be seeking an answer of, do they have the spike protein in their body and how much?
Yeah. But with this protocol, you feel like it could be eliminated.
Right. We are following this over time. We do see antibody levels come down. I bet we'll find antigen levels coming down as well. The body has to be detoxified of this. It's very important. Looks like the body can't get rid of spike protein on its own very well at all. And as proposed, intermittent fasting, sweating, going in saunas can play a role, hyperbaric oxygen. But I think we need enzymatic assistance in clearing spike protein, and that's what nattokinase and bromelain do.
Oh, so there is some evidence of intermittent fasting and being able to reduce it, possibly?
Well, there's at least this suggestion, and that's because intermittent fasting helps autophagy. That is the programmed cell death, where cells who are going to normally turn over, and if they had spike protein, if that cell undergoes senescence, it's got a pretty good chance of clearing it out.
Is that a pretty common thing just in general for health, the intermittent fasting? It can help with a lot of issues like that, because I had a doctor on here. I don't know if you're familiar with Dr. Thomas Seyfried, but I mean, he talks about intermittent fasting and a ketogenic diet to help kill cancer cells.
Well, those are two separate things, but intermittent fasting's been part of major religions throughout the history of the world. It's pretty interesting.
Mm-hmm.
And there are positive data for intermittent fasting. Ketogenic diet is something very different, where one would eat essentially no carbohydrates at all and eat high amounts of protein and fat to try to induce a metabolic state where the body actually has circulating ketones in the human body. And those are, in a sense, form of acids. and the breath changes, and things change dramatically. There are case reports where it's been tried in cancer. People have figured, listen, why not? And recently on my show, I had Dr. Annette Bosworth. She's known as Dr. Boz. So if you ever want to have a great guest, give you the story of the vignette of her mother on a ketogenic diet and what the benefits are, you may want to consider to bring her on. I think I'm more of a dietary moderate where, I try to avoid starches. I try to avoid the 3 S's: sugars, starches, and saturated fat. But I don't try to put myself into ketogenesis. And what Dr. Boz told me is that someone's on a ketogenic diet and they use a urinary dipstick test to prove that they have ketonemia and ketonuria. She told me that eating 1 apple will take somebody out of ketogenesis. 1 apple. And I got to tell you, I personally have never found somebody who became obese eating an apple. I tend to doubt that eating an apple is harmful for a cancer patient. So I think moderation is probably somewhere there. But there's more and more data that the 3 S's are the problem: sugars, starches, and saturated fat. And if cancer patients are eating lots of sugary and starchy foods, diabetics are doing this, those with COVID are doing this, they're just getting worse and worse and worse.
Yeah. Well, that's what the doctor was saying, because I asked him, well, what is the diet that they recommend to cancer patients? And he's like, eat as much as you can, and sugar and all, they don't want people to lose weight. And he said, that's feeding the cancer cells, and it's terrible.
Well, it's true. I'm not an expert in cancer, but I can tell you in COVID, there is paper after paper after paper showing eating sugary and starchy foods makes the infection worse. The infection, the virus, inflammation, probably cancer cells, they feed on sugar. That's the last thing you want to do if you have cancer.
Yeah, I think you mentioned that about COVID before too. Yeah, I think I read that. So that is, I mean, you'd think some of this stuff is common sense, but eating junk food. I mean, I remember they used to had the food pyramid, right? And it would tell us to eat a bunch of bread and starch, but I don't think that's probably good anymore.
No, I mean, the whole dietary clinical nutrition world has a pretty dark history. They said the base that we should be eating lots of white bread and flour morning, noon, and night. That was completely wrong. I mean, that was a recipe for getting fat. And in fact, Americans got fat. And we've learned over time that, what I've learned of this is the body needs high quality sources of protein. And the quality of the protein is really defined on the package in which the polypeptides are contained. So the highest quality sources of protein are fish, beans, nuts, egg whites, non-fat dairy, occasional lean meats, and chicken. Occasional, not chicken every day. And then fresh fruits and vegetables unlimited. What the body does not need are sugars, starches, that means anything made out of flour, rice, and potatoes. And the body doesn't need saturated fat. That means, lots of gooey cheeses, regular ice cream, greasy meats. The human body doesn't need that.
What are your thoughts on like beet juice or celery juice, or is there any sort of like fruits and vegetable kind of juice or anything that you recommend that is good for your heart? Or just
vegetable juice is simply a way of eating more vegetables, and to that extent, it's pretty good. Beet juice is attractive because beet juice contains vasodilatory, very favorable substances for the heart, so that looks pretty good. We want to avoid fruit juices, though. Fruit juices simply are concentrating the sugar from a lot of fruit. So, instead of drinking orange juice, which is the sugar from 10 oranges, you're better off eating 1 orange and getting the taste of an orange and the fiber.
Yeah. And what about like magnesium supplements? Do you recommend? Because I hear a lot of Americans are also vitamin D and magnesium deficient, but the magnesium can help synthesize vitamin D.
Yeah, recommend both. The reason why people are magnesium deficient is they drink bottled water or filtered water. So it's filtering out the magnesium. So we commonly recommend magnesium for people with palpitations, extra heartbeats, muscle cramps at night. We recommend vitamin D. Most of us get insufficient sunlight to convert vitamin D, so we need vitamin D supplementation. But these are common things that now over time have borne out. And if there's any deficiency in the literature, it's typically not testing high enough doses.
That's interesting. What are your thoughts on trendy drug right now is like Ozempic or those kinds of similar? Do you have any thoughts on that or theories of is there going to be side effects to these drugs that come out later? I mean, some are already having side effects now.
These drugs are called GLP-1 agonists, and they are effective in curbing hunger and losing weight. But predictably, patients regain all the weight when they stop them. There are injections that have to be given once a week. So, in a diabetic who's obese and struggling, I'll prescribe Ozempic or Mounjaro. But it really ought to be done, I think, with a goal of trying to help a diabetic. It shouldn't be done for cosmetic weight loss.
Yeah. I mean, it's just so interesting, like reading your book and learning about the FDA and all these drugs and how it's just confusing because I remember going back to the COVID stuff, it's the ivermectin and it was so demonized and there was all these jokes about it and all this. And when you kind of dig deeper and you talk about this in your book, how that, they were pushing a different antiviral medication because they can make more money because ivermectin is a generic. So there's not a lot of money to be made with that. Is that correct?
It's true. Ivermectin, very affordable, safer than Tylenol, over 100 studies, very effective in COVID, both inpatient and outpatient. Hydroxychloroquine, equally as affordable, more favorable data, over 300 studies, mainly with outpatients. Aspirin, very affordable. Vitamin D, the nasal sprays available, colchicine, all of them were demonized. All of them were impeded by the federal government. Even high-tech, expensive products like monoclonal antibodies, which are safe and effective, they were taken off the market one after another by the federal government. So federal governments all over the world worked to suppress any hope of treatment. And as a result, Americans and people across the world, they suffered, they were hospitalized, and they died.
Yeah.
And this was a method, I think, to force people into vaccination.
Yeah, because so with the ivermectin, explain how that works because I don't know a lot about it. I know it's an anti-parasite drug. And so some of the evidence was in India, but they were saying, oh, well, the only reason it helped with COVID in India is because there was more people with parasites. So how did it help people like Americans? How did it work for them?
Ivermectin's been shown to block the effects of the spike protein on the virus. That's the injurious part of the virus. It inhibits the virus from penetrating the human nucleus, and then it influences the expression of certain inflammatory factors. So these are well proven in preclinical studies. And in the United States, a prospective comparative study, the ICON study, was published out of Florida by Dr. Jean-Jacques Roster, published in Chest, our best pulmonary journal. And ivermectin was associated with a 50% reduction in mortality. So it wasn't just India, and it had nothing to do with parasites. It directly saved lives of people sick with COVID-19, which is a viral illness.
Yeah, it was part of that protocol that you had, and you kind of had to get on it quick, right? They had to get it fast before the virus could replicate. Is that how it
That's
works?
true. The antivirals, hydroxychloroquine, ivermectin, and then if Paxlovid or molnupiravir is used, or outside the United States, favipiravir, just needs to be used quickly. With ivermectin, it just took time for us to learn the dose. The dose is 0.6 milligrams per kilogram. So these are compounded capsules nowadays. So someone your size would probably take about 48 milligrams, maybe 36. So they're in 12 milligram increments. A smaller woman may take 24 milligrams. A big man may take 60 milligrams. But these are the doses now we're using for ivermectin, much higher than originally proposed.
Are people still getting that regimen with COVID? I mean, is there still a risk of dying of COVID? Or I mean, you just don't hear about it as much. Is the virus kind of mutated so that it's a lot weaker now? Or are people still struggling?
The virus is mutated. It's far weaker. People have had previous infections, so they have natural immunity. So there's little risk of hospitalization or death with COVID. Now, occasionally we'll find some seniors. I recently had two patients in my office in their 90s with their first episode of COVID, and they needed full McCullough Protocol. They needed some IVs in the office. They got through it fine. But people on their second or third infection, it's mild. We still use ivermectin because it can help them with symptoms. I have a man right now who had severe COVID, was hospitalized the first time. He's got symptoms again. So I have him on ivermectin. He's going to get through it just fine.
Is that the same protocol that Joe Rogan took? Because he got better in like 3 days, he said.
Yeah. Joe Rogan, Aaron Rodgers, even former President Trump, they all got versions of McCullough Protocol. So it was great to see him get better.
So do you think Trump and some of these politicians, did they actually get the vaccine, or because they say that they did, but I mean, I don't know. I'm skeptical. I don't know what to believe anymore.
Well, I think we should take it at face value. I think they took the vaccine. I think the bigger question is, why aren't they calling for the vaccine to be pulled off the market? Why are they not alarmed with record numbers of cardiac arrests, strokes, blood clots, immunologic problems? The CDC says 18,655 Americans have died with taking the vaccine, 1,150 right after they take it in the vaccine center. A few hours later, 1,200 the next day. What president would not be alarmed with a couple thousand Americans dying right after they took the needle? It's probably underreported by 30. So the true number of people who died in the United States with the vaccine could be, 550,000 Americans, more than 500,000 Americans died. That should be the number one talking point on every platform of people running for office. And yet we have two presidential candidates, our two main ones. They're responsible for bringing us the vaccine, for mandating the vaccine. And now guess what? They both want to be in office again. And neither one is expressing any concerns over vaccine safety. Americans should be outraged.
Well, yeah, and I find it interesting in your book. I mean, everyone wants to label you as a right-wing QAnon conspiracy theorist, but in your book, you say you actually voted for Hillary Clinton and Obama.
Yeah. So I am an independent. I've voted Republican. I've voted Democratic. I voted for the Bushes in the past. So you can see how these various pundits are so wrong in their labeling of things.
Yeah,
I'm a political independent, but I got to tell you, this race coming down, I talked to the average American. They don't want Trump and they don't want Biden. They want us to get some fresh ideas, particularly our senior citizens. They were burned with COVID. They saw the Trump administration grossly mismanage the country. The last year of the Trump administration was a disaster. He walked us right into the pandemic, locked us down, rolled out remdesivir, hired Fauci. I mean, couldn't be worse. It was a disaster. And the Biden administration was installed, and they've been even worse.
So you're not riding with Biden this time?
I think it's a vote for either one right now is a vote for more vaccine misery. So I think really, really tough. I think they have to now. Biden and Trump are vaccine brothers. They are the same on the vaccine. So if either one of them want to distinguish themselves, they should come out and tell us what they think about the vaccines.
So then
they should differentiate. This is the political opportunity of a lifetime. I think whichever candidate comes out and says, you know what, the vaccines were a giant mistake. If I'm reelected, I'm going to make this right for America. There will be a gushing sound of votes. If either candidate says that, I think they're going to win the election. But if neither candidate is willing to talk about the vaccines, we're coming down to another nip and tuck election. No one knows what's going to happen. Both sides are going to claim election fraud if they lose, right? So remember when Hillary Clinton lost, she declared that there was, election integrity issues. Trump lost. He claimed there's election integrity issues. So, this voter fraud, election integrity, it's kind of a sore losers campaign after that. I think America is sick of sore losers. We should just have people who run on issues, who are clear with the country, can understand if we've got the country suffering from a miserable COVID-19 pandemic response and vaccine campaign, they should come out and level with the country. They can win the election.
I agree 100%. What are your thoughts on RFK Jr. then? Because I think you were mentioned in his book, The Real Anthony Fauci, and you guys have a lot of similar beliefs on COVID-19 and vaccines.
Well, unlike Biden and Trump, who I don't know personally, I do know RFK personally, and he does offer, clarity on the pandemic response and the vaccines, which is good. The challenges he faces are going to, be getting on the ballot in all the states and becoming much more presidential. What I'd like to see out of him is, standard comments about the economy, foreign affairs, domestic affairs, education, immigration. He's got to put it together and become more presidential. I think what I'm seeing right now is just too argumentative, almost like a litigator wants to, litigate the CIA and what have you. And now's not the time to do that. Now's the time to really take on a presidential persona and take a stance on how they're going to lead the country.
Yeah, you have bring up a good point about. I don't know if there's a lot of difference. I mean, there's problems with both of those, and even the third guy, RFK. What I find interesting too is that I never heard, because I watched a lot of those press conferences during COVID with Trump and Fauci, and they never talked about a lot of the common sense approaches to treat COVID in terms of preparing yourself for catching a virus, like exercise, sunshine, drinking water, boosting your immune system with vitamin C, zinc, natural supplements. I didn't hear any of that.
Both of them have done a terrible job preparing the country for a pandemic or to manage through a pandemic. We're now being threatened with disease X. You mentioned bird flu. We're right back to the same fundamentals. Our public health agencies have held no open forums. There's no Q&A. There's no practical sets of regulations. In fact, just the opposite. For the virucidal nasal sprays and gargles, every company was tied up in court with the Federal Trade Commission. They didn't want anybody to use nasal sprays and gargles. Eric Naputi, who is an innovator with vitamin D supplements, he was viciously attacked in the courts by the Federal Trade Commission. It cost him a fortune to manage out of that. So both the Trump administration and the Biden administration have been terrible. It would have been better if they were just neutral. Do you know when the Spanish flu pandemic, Woodrow Wilson was the president? He never mentioned the pandemic.
Really?
Yeah. It was a problem that doctors handled. It wasn't a presidential issue. We would have been better off if the president stayed out of it, the government stayed out of it, and the doctors just handled it. We would have been fine.
Well, it was interesting in your book. This was probably one of the most shocking parts where you talk about most of the doctors were scared themselves of getting it. So they didn't want to treat, they were worried about how do we protect ourselves with masks and the gear or whatever. And so you were one of the few that was like, okay, how do we treat this disease?
Right.
How do we help patients get better?
That's so true. The conference calls that I remember were all about personal protective equipment, hand sanitizers, gloves, reverse ventilation. Everyone was worried about themselves. They were playing defense, trying to protect themselves as opposed to help patients. And as a doctor, my first priority is always the patient. We always put the patient above ourselves. We didn't see that at all with the pandemic response. Yeah.
And doing my own research, and I know you're not supposed to do that, but they used to call it reading, right? That's Jimmy Dore's joke that it was like, doing your own research used to be called reading, but now it's terrible. But with the prescription drugs, just the process, do you understand the approval process with prescription drugs? That I was reading this thing about they can run 50 studies on a drug, and as long as 2 of them are positive, then it gets FDA approval. Or something.
The drug approval process is driven by the companies who want to apply to have a drug approved by the FDA. So the companies get to pick what studies they do and how they assemble their dossier. So it is driven by the companies. It is the process of what it is. What the FDA should be is an unbiased regulator, looking at the full breadth of the data and ensuring safety. That's more than anything else. The FDA is not in a position to try to tell us, risks and benefits and try to tell us how to practice medicine. They're not a set of qualified doctors or even licensed to do that, but they should be able to regulate on safety and protect Americans from unsafe products. Where the FDA has failed is they should have pulled the COVID-19 vaccines off the market very early in 2021. They're not safe for human use. Now we have multiple societies that are calling for the vaccines to be pulled off the market, and the FDA is behind on this. This is not looking good.
Yeah. Well, so what is your take on I think it was the Lancet study that said the COVID vaccine prevented whatever 1 million deaths or whatever? Like, what are your thoughts on that? That seems like, I don't know how they measured those statistics of how it could prevent. And then we didn't have a control group of people? I mean, did we? Or I guess I don't really understand that study.
No, the prospective randomized trials, placebo-controlled, are the only ones we can use to try to discern if the vaccines save lives. And in those trials, more people died with vaccines than with placebo. So the vaccines did not reduce death rates at all, did not. Now we have a paper out of Montreal, Dennis Rancourt, an ecological analysis. His conclusion is the opposite, that the vaccines have actually caused about 17 million deaths. So I would follow the Rancourt data. The vaccines are causing death. We have 4,000 peer-reviewed papers describing fatal and non-fatal vaccine injury syndromes. The vaccines didn't save lives. They've cost people their lives.
Well, yeah, and like I said, I know for a fact there's tons of people that are having side effects from both COVID and from the vaccines. But I know that if you ask Siri, this is a fun test, is to ask, Siri, who paid the largest fine in US history. It's Pfizer. They paid a $2 billion fine, but they made 8 billion that year. So they're still okay. They're still in business. I mean, there's Bayer that make aspirin and other things. They sold a drug that was infected with the AIDS virus, and then they just dumped it overseas, and they're still in business. So what is the FDA doing? Why are these companies still in business if they're doing terrible things that are hurting people?
Sadly, the FDA is corrupted by big pharma. They receive most of their revenue from fees they charge big pharma. 9 out of the 10 last FDA commissioners, they go work for a big pharma when they're done at the FDA. So it's a corrupt system. It's what we call the biopharmaceutical complex in our book. We can't trust the FDA at this point in time. They're not making decisions that are in the best interest of the health of Americans.
Yeah, it was something like there's 1,145 lobbyists. Well, this was in 2013 compared to 535 members of Congress. So that's like $400,000 per congressman. And yeah, pharma can pay all these fees to speed up the approval rating. I mean, it seems highly corrupted.
It's a very corrupt system. We've got to get the big pharma money out of the FDA. We need to clean house at the FDA. FDA should have a major focus on drug safety, constantly having safety reviews. The FDA is not reviewing the safety of the COVID-19 vaccines or drugs like remdesivir in its in-hospital use. So we have a situation where the FDA is off the rails, and they're not protecting us against what is a evolving debacle, a biopharmaceutical debacle that's causing more harm than good.
Yeah, it's scary because I always just want to be able to trust our government and trust that the FDA has done their job. But I feel like it's not just the COVID vaccines. I feel like it's other drugs and even things in our food that we're not being told about that have long-term effects. And I also don't think that we know a lot of the effects. When the COVID vaccines came out, they said these are safe and effective. I'm like, how can you know the long-term effects of this vaccine? It's only been around for what, like a year or whatever. So I don't really understand how they can say that it's 100% safe and it won't cause any side effects, especially later down the line.
These are fraudulent claims. Remember, in the clinical trials program, the primary series took a month to get these 2 shots, and they had just 2 months of observation. No one knew at month 4 or 5 or 6 what would happen. So anybody claiming that they were safe and effective was basically making a statement that was out of an article of faith. It wasn't based on data. It was wishful thinking. Maybe they wish they would be safe and effective, but no one could know if they were safe and effective because they were too new.
Right. And like you said, I mean, we're seeing, I think possibly it could just be the tip of the iceberg with these issues that a lot of people, I mean, because we won't see the long-term effects of this for 50 or 100 years. I mean, if like a kid got a COVID vaccine at 6 years old, we might not see the effects of that for a while, right?
It's so true. The recent Pfizer study has just come out on doing the vaccine, giving the vaccine in pregnant women. And this is a small study. They stopped early. It's grossly underpowered. But I got to tell you, there was 4 times as many birth defects in babies from vaccinated mothers compared to unvaccinated. I mean, this is awful. This is absolutely awful. So parents that have children with birth defects now, one of the first questions we're going to ask is, did you take a COVID vaccine?
Oh, that's really scary. Is that something that this would happen Like, I mean, you're saying if they got the COVID vaccine while they were pregnant or just even before that?
Well, this was a study of giving the vaccine while they're pregnant, which is a disaster. That's pregnancy category X. I published that for Americans in 2021. I told everyone a pregnant woman should not take a brand new genetic injection during pregnancy. That sounds bad. It is bad. Now the data are clear. It causes birth defects. But there's a great concern since these are long acting. People have taken the shots in the years before they conceive, both the men and the women. We have no idea what's going to happen. People have to understand we can't play around with genetic technology and hope that it was going to be safe and going to be okay. Chances are it's not.
Yeah, I mean, that always scared me. I took the Johnson and Johnson vaccine because I thought, well, at least that technology's been around longer. But I still feel like I have a weird, like, I might have to do this McCullough protocol because I still feel like I have shooting pains in my hands and numbness in my hands that I'd never had that before.
Yeah, no, even the Johnson vaccine installs a massive amount of spike protein in the body and has long-acting effects. Brogna and colleagues showed the spike protein is circulating in the bloodstream for at least 6 months, maybe longer. So patients like you, I would get the extended range antibody test against the spike protein, see how much we're dealing with, do an assessment. You're right, McCullough Protocol, base spike protein detoxification. If any of the autoimmune markers are positive, we usually use hydroxychloroquine. So we are able to get people to resolve the syndrome, but it takes an adept practitioner, I think an unvaccinated doctor, to help discern what's going on, get people on the right track.
What was the test that you said to use?
It's called the LabCorp Extended Range Antibody Test against the spike protein.
Okay. And so that's something that I can talk to a doctor about. That's someone that actually is going to do because I feel like you're right. I think a lot of doctors are just going to dismiss this as, oh, you've just been reading too much on the internet. And, but there's people that are suffering. One person I'm going to have on my podcast, actually, I don't know if you remember this nurse, Lindsay. I don't know what her last name is. Like Lindsay RN is her Twitter handle, but she had huge side effects. Do you remember her?
Yeah, poor Lindsay. I think that's Lindsay House. She's had a miserable time, hair falling out, autoimmune problems. She sought a myriad of treatments. I have patients, my office is loaded with patients like that.
Wow. And so, but hopefully a lot of them are seeing some positive effects from this protocol that you've created.
Yeah, it just takes a long time.
So it could take 3 months minimum, could take a year, could take longer than a year.
It could. Now, remember, these are safe to use long-term anyway. Patients with heart disease are probably going to use nattokinase long-term anyway. But yeah, people should plan on a long haul for this.
Yeah. Is there any other things that you recommend for just general heart health or?
Well, general heart health, I advise the wellness company as the chief scientific officer. And the one supplement I'm really high on is called Heart and Muscle Support from Wellness Company, twc.health.com. It has everything in it that I'd recommend for the patients with heart disease, including acylcarnitine, D-ribose, B vitamins, selenium. It's a great product, 1 capsule twice a day.
Yeah. I mean, do you think statins are being over prescribed, or it seems like there's a lot, or our chronic health is getting worse and the prescription drugs is going up? Is there a connection there, or is that just because we're living longer, or what's the story with that?
I think health getting worse is probably more related to diabetes and lack of physical exercise. It's easy to kind of blame the drugs, but come on, people are enormous. They can't even run a mile or two. And the drugs are largely probably appropriately used. I mean, statins do reduce cholesterol. It results in lower rates of heart attack, stroke, bypass surgery, angioplasty. They have side effects. About 15% of people have muscle aches. It's not a big deal. We stop the statin, it goes away. But statins clearly have a role. So does ezetimibe. If they can't tolerate statins, we use injectable drugs called PCSK9 inhibitors. So we have a lot to do. Before we had statins, we had about 1 million bypass surgeries in the United States, and now we're down to about 150,000. So
wow,
clearly they've made a big positive impact.
But so what you're saying too is that if people ate better, exercised, took care of themselves, maybe we could avoid having people go on all these prescription drugs as well.
Well, certainly for diabetes, that's the case. Maybe avoiding in some people, blood pressure lowering, lipid lowering therapy. It is a lean horse for a long race, no doubt about it. Staying free of smoking, no alcohol. If one can lead the cleanest life possible, that's the best chance of not needing drugs.
No alcohol at all, huh? Because see, my grandfather, he's lived to 91. He drank martinis every day.
Well, there you go. But yeah, and on balance, there are risks and benefits of drinking alcohol, but in balance, the risks outweigh the benefits. So I think the big ones are disturbing sleep. People drink alcohol, never sleep good. And then atrial fibrillation, getting on blood thinners, having ablations, and having it all related to alcohol. It's not worth it.
So was the research with that though? Because they would say like drink a glass of red wine because doesn't alcohol thin your blood? So then that would help a little bit with the heart stuff, right?
Well, alcohol raises HDL cholesterol a little bit, but again, the downsides of alcohol, not sleeping right, atrial fibrillation, gaining weight, making people out of shape. It's very hard to be in shape when you drink alcohol. It's just not worth it.
Yeah. Moderation then is the key, or just to cut it out entirely.
Yeah, I think if you want to sleep well, most people, they find get to about 28 days, no alcohol, sleep comes back to normal. It's so worth it to have good quality sleep.
Great. Awesome. Well, great stuff. Thank you so much for doing this. People can follow you on Twitter, and I'll put your website in the show notes. Anything else you have?
Yeah, well, be sure to follow me on Twitter. I got the top doctor account on Twitter, over 1 million followers of doctors who see patients. McCullough Report podcast every Saturday and Sunday, 2 p.m. Eastern on America Out Loud. Courageous Discourse Substack, top medical Substack, 90% of the content's free. Sign up for Courageous Discourse. And then, of course, my book, Courage to Face COVID, couragetofacecovid.com. 5-star bestseller. It's the only book during the COVID genre that Amazon attempted to ban. An enormous public pressure, Amazon was forced to put it back on the market. There's nothing wrong with the book. It's a hot book. People want to know why it was banned, and it's obvious you read it, and you can attest that it's easy to read. It's a fun read.
Great book. I got it on Audible, and I'd go at double speed, and you cite all the sources. I mean, in every interview, I watch a ton of your interviews. You're always citing the things, and then I'll try to watch the debunking videos for people that try to debunk you. And they always just say the same thing. Well, the CDC said this, and I'm like, okay, but have we not proven that the CDC and the FDA and all these organizations have made a lot of mistakes? And I feel, maybe I'm wrong, maybe this is not true, but it seems like they are corrupted. And that's what you're saying too. And I agree. I think people trust you. That's why you're the #1 most followed doctor.
Thank you. Thank you so much. It's great to be on the show.
Yeah. Thank you so much for doing this. I'll get it out soon. Thanks so much.